every 62 minutes, at least one person dies from an eating disorder. It's painful, sickeningly lonely, and one of the worst ways to die. Eating disorders are the most life-threatening mental illness, yet it gets only a quarter of the funding of schizophrenia, while being just as common. To understand eating disorders, we first must discuss how they work, myths, and challenges faced.
Eating disorders are conditions related to eating behavior that impact physical, mental, and emotional health. The most common types of eating disorders are bulimia, which is self-inflicted vomiting, anorexia nervosa, which is extremely limiting calories and weight increase, and binge eating, which is compulsive overeating. All of these are extremely taxing to the body, cause feelings of shame, and are excruciatingly painful. Not many can imagine what it feels like to not have ingested any food for days, but this fate is felt by thousands of people around the world.
I'm sure you've all understood how horrible eating disorders can be and want to learn how they are treated. Unfortunately, scarcely any research surrounding eating disorders exists, as it was only recently considered a serious mental illness. The shift in the mental health discussion means that we have some treatments.
For adults, cognitive-based therapy, or CBT, is used, which works to change thought processes surrounding food. This combats bulimia and binge eating, but is almost useless for anorexia nervosa. For teens, family-based therapy, or FBT, is used, where a family works together to create a positive eating environment for their child. However, no treatments are universally effective. This, mixed with the fact that there is no research on curing anorexia in adults, means this field is in desperate need of funds.
Our government plays a very limited role in providing treatment for eating disorder sufferers. In Canada, there are no long-term, publicly funded residential care facilities. Waiting lists for what little is provided are so long that many must go abroad for private health care, only to return to no follow-up care. Out of the 4,100 psychiatrists in Canada, only 12 specialize in eating disorders. Given the high mortality rate, we should be ashamed of the lack of compassion that this nation shows for such a prevalent issue in our society.
And what's even more concerning than the lack of treatment are the countless misconceptions, stereotypes, and misinformation that has accumulated regarding eating disorders. Many people assume that eating disorders are a choice. This claim is 100% false. Eating disorders are actually complex medical and psychiatric illnesses. Even professionals in this field do not fully understand how to treat patients with this illness, since only 3 hours of their entire education of up to 12 years is spent learning about eating disorders.
The most important fact about eating disorders is that they affect everyone. When talking with our charity, Sheena's Place, we learned that eating disorders can be developed by anyone, regardless of race, age, sexual orientation, and most importantly, gender. Eating disorders are often thought of as impacting almost exclusively white adolescent girls, which is completely false. Everyone is equally vulnerable, and everyone deserves help. This is why this issue not only needs our attention, but our understanding.